Welcome, and thank you for coming to the Allegri Method Training Event 3, One Cranial Nerve at a Time, developed by Sara Allegri and Joseph Sapala. Cranial nerves, and why they are so important to consider in your daily routine. Thanks to your cranial nerves, you can experience the 5 senses, make different facial expressions, blink, move your tongue around, and much more. Cranial nerves are incredibly important because they facilitate communication between the brain and the rest of your body. They guide us through this complex world of sensations and signals and are considered your very own primary survival kit. The 12 pairs of cranial nerves and their specific function. Cranial nerve 1, olfactory, sense of smell. Cranial nerve 2, optic, vision. Cranial nerve 3, ocular motor, eye movement, pupil control. CN4, trochlear, eye movement, superior oblique. CN5, trigeminal, facial sensation. CN6, abducens, eye movement, lateral rectus. CN7, facial, facial expression. CN8, vestibulocochlear, hearing, balance. CN9, the glossopharyngeal, taste, swallowing, and salivation. CN10, the vagus nerve, controls heart, breathing, and digestion. CN11, accessory, neck and shoulder movement. CN12, the hypoglossal, tongue movement. Cranial nerves and exercise. How they play an important role. Cranial nerves play a vital role in coordinating movement, maintaining balance, and regulating essential bodily functions. They promote brain health and neuro rehabilitation, especially beneficial after a stroke or brain injury. By consciously activating the nerves, we can enhance brain activation, the ability to increase neural activity in specific regions when processing a stimulus. Consider the anatomy. Memorize their function. Also consider the fact that nerves share functions and work together to communicate and send signals to the brain. Why consider the cranial nerves in exercise? Cranial nerves can affect your exercise routine performance. Number 1, optimize performance. Healthy cranial nerves are essential for smooth, coordinated movements, accurate vision, and proper balance. Number 2, injury prevention. Deficits in cranial nerve function can increase the risk of falls and injuries. Number 3, rehabilitation. Specific exercises can be used to improve the function of cranial nerves that have been affected by injury or disease. Number 4, overall well-being. Besides enhancing physical performance, they improve your quality of life. The olfactory nerve. The cranial nerve 1 is considered a component of the central nervous system. The olfactory nerve, cranial nerve 1, role and function. As a role, sense and smell. Function, sensory. Perk, facilitates emotional processing. Location, forebrain. The olfactory nerve. Parts of cranial nerve 1. The olfactory bulb. The organ responsible for receiving scent information is nestled in the sinus cavities, positioned delicately between your eyes, just above the hard palate. Notice the delicate filaments falling from the bulb, called olfactory nerve fibers. They extend downward into the nasal cavity. These fibers, which are purely sensory, detect volatile molecules and translate them into the language of smell. Observe the figure carefully. Take a moment and consider the anatomy. Now close your eyes and envision cranial nerve 1, the filaments fanning out, the depth of the nasal cavity, the air entering your nose, and how smell brings presence, awareness, and even calm. This is not just sensory, it is emotional and cognitive. Olfactory pathways, abbreviations for the brain regions: piriform cortex, amygdala, entorhinal cortex, hippocampus, thalamus, orbital frontal cortex. Benefits of olfactory stimulation. How scent affects your brain and body. Number 1, emotional regulation. Lang Lang has the ability to reduce the activation of the sympathetic nervous system. Number 2, heart rate and balance. Lavender can improve your HRV, your heart rate variability. Blood pressure. Number 3, sage can lower blood pressure. Number 4, cognitive enhancement. Peppermint is linked to faster processing speeds. Evolutionary and social functions. Sense of smell plays a fundamental role in detecting danger, for example, smoke, and identifying social cues. Exercises for the olfactory nerve. Olfactory training. How to stimulate cranial nerve 1. Select 4 scents. Sniff each one for 10 seconds. Concentrate on the smell and memories associated with it. Let's stimulate. Did you know the scent of peppermint can make you run faster? The optic nerve. The cranial nerve, too, is the only nerve that is considered part of the central nervous system. The optic nerve, cranial nerve 2, role and function. Role, eye movement. Function, sensory. Perk, neither extensor or flexor. Location, the forebrain. The CNS. The central nervous system is the body's control center, consisting of your brain and spinal cord. Your CNS receives, processes, and coordinates information from the entire body, controlling everything from thought and movement to involuntary functions like breathing and heart rate, along with your brain and spinal cord. The PNS, your peripheral nervous system, transmits sensory information to the brain and spinal cord, and motor commands back to muscles and glands, enabling movement and sensory perception. The PNS is divided into the somatic nervous system, which controls voluntary movements and senses, and the autonomic nervous system, which controls involuntary functions. The optic nerve pathways. Cranial nerve 2 is a sensory nerve with these specific roles. The primary visual cortex is located at the back end of the brain in the occipital lobe. The inside part of the right eye and the outside part of the left eye both detect stimuli in the right visual field and the optic nerves carrying information from the eye to the brain. So the right visual world all ends up in the left side of the brain. The optic nerve. Cranial nerve 2 is a sensory nerve with these specific roles. It controls the left and right visual fields. It carries visual information from the retina to the brain's visual processing center. It is located in the forebrain, which controls body temperature, reproductive functions, eating, sleeping, and emotions. Did you know you can relax your neck by relaxing your eyes? Optic nerve exercises. How to stimulate cranial nerve 2. Close your eyes. Relax the muscles around your eyes. Feel the back of your neck release. Feel how your breathing changes. This is good for headaches and neck tension. Let's try it. The ocular motor nerve. The cranial nerve 3 is responsible for the 4 major muscles surrounding your eyes. The ocular motor nerve, CN3, role and function. Role, eye movement. Function, motor. Perk, increases flexor tone. Location, in the midbrain. The ocular motor nerve. The cranial nerve 3, major muscles and movement. Medial rectus, inward. Inferior rectus, downward. Superior rectus, upward. Inferior oblique, up and outward. The ocular motor nerve. The cranial nerve 3, function. This motor nerve enables the eyes to move within their sockets. It also plays a role in eyelid elevation, aids in eye focus on nearby objects, and contributes to pupillary constriction. This nerve facilitates object tracking while maintaining focus, which is crucial for various forms of exercise and sports. Ocular motor nerve exercises. How to stimulate cranial nerve 3. Eye push-ups, eye circles, figure eights, blinking, using the Brock string. More ocular motor exercises. How to stimulate the cranial nerve 3. Smooth pursuits, saccades, VOR, gaze stability, peripheral awareness, tossing a tennis ball. Note, these exercises can also be used for concussion therapy training. Let's stimulate. The trochlear nerve. The cranial nerve 4 plays a crucial role in controlling eye movement. The trochlear nerve. Cranial nerve 4, role and function. Role, eye movement. Function, motor. Perk, increases flexor tone. Location, the midbrain. Trochlear nerve. Cranial nerve 4, crucial roles. Controls eye movement. Carries signals from the brain to the superior oblique muscle. Allows eyes to move down. Helps maintain focus while tracking objects. It helps move your eyes toward your nose, adduction, or away from it, abduction. Trochlear nerve exercises. How to stimulate cranial nerve 4 with head and eye movement. Try the H pattern. Pencil push-ups. Figure 8. Look down and in. Use the Brock string. The trigeminal nerve. The cranial nerve 5 provides motor and sensory for head and face. The trigeminal nerve, cranial nerve 5, role and function. Role, facial sensation. Function, sensory and motor. Perk, increases extensor tone. Location, the pons. Trigeminal nerve, cranial nerve 5 and its branches. Provides head and face motor sensory controls. Chewing muscles. Sends pain, touch, and temperature sensations from face and head. Has 3 branches. 1. The ophthalmic nerve. 2. The maxillary nerve. And 3. Mandibular nerve. Trigeminal nerve exercises. How to stimulate cranial nerve 5. Jaw opening. Jaw circles. Figure 8. Tongue to the spot. Z-vibe on tongue. Eye massage. Z-vibe in the corner of the eye. Z-vibe on top of nose. Z-vibe on eyebrows and scalp. Blinking and chewing. Jaw drop. Side to side jaw. Let's try a few. The abducens nerve. The cranial nerve 6 innervates the lateral rectus muscle of the eye. The abducens nerve, also known as the abducent nerve, cranial nerve 6, role and function. Role, eye movement, function, motor. Perk, increases extensor tone. Location, the pons. Abducent nerve, cranial nerve 6 primary functions. Innervates the lateral rectus muscle. Moves eyes outward. To look left and right. Allows us to track objects and maintain focus. Abducens nerve stimulation. How to stimulate cranial nerve 6. Eye circles. Figure 8. H pattern. Brock string. Pencil push-ups. Blinking. Let's stimulate. The facial nerve. The cranial nerve 7 controls muscles that help you smile and raise your eyebrows. The facial nerve, cranial nerve 7, role and function. Role, facial expression. Function, sensory and motor. Perk, increases extensor tone. Location, the pons. Facial nerve, cranial nerve 7, muscle control. The facial nerve, cranial nerve 7, controls several muscles in your face, like the ones that help you smile, wrinkle your nose, and raise your eyebrows, forming countless facial expressions, while also controlling talking, tasting, and tears. The parasympathetic nerve fibers of your facial nerves trigger saliva and tears. Facial nerve exercises. How to stimulate cranial nerve 7. Eyebrow raise, number 1. Number 2, tongue movement. Number 3, cheek puffing. Number 4, smiling. Number 5, lip movement, kiss and smile. Number 6, use Z-vibes. Number 7, blinking exercises. Number 8, the smolder. Let's stimulate. The vestibulocochlear nerve. The cranial nerve 8 is crucial for balance and coordination. The vestibulocochlear nerve, cranial nerve 8, role and function. Role, controls hearing and balance. Function, sensory. Perk, increases extensor tone. Location, the pons. Vestibulocochlear nerve, cranial nerve 8, vital functions. The vestibulocochlear nerve, cranial nerve 8, is crucial for balance and coordination, helping us maintain stability during movement and exercise. Vestibular and cochlear nerves and their function. The vestibular nerve innervates the vestibular system of the inner ear, which is responsible for detecting head movement and position, allowing posture control and stable vision during physical activity. The cochlear nerve is primarily responsible for transmitting auditory information from the inner ear to the brain, enabling hearing and sound localization. Vestibulocochlear exercises. How to stimulate cranial nerve 8. Tilt your body. Snap your fingers. Balance exercises. VOR. VOR with wedge. Let's stimulate. The glossopharyngeal nerve, cranial nerve 9, is about taste, sensation, swallowing, and speaking. The glossopharyngeal nerve, cranial nerve 9, role and function. Role, controls taste, swallowing, and salivation. Function, motor and sensory. Perk, increases flexor tone. Location, the medulla. Glossopharyngeal nerve, cranial nerve 9 functions. Taste in the back of the tongue. Sensation in your throat. Salivation. Innervates salivary glands. Regulates blood pressure and oxygen levels. Glossopharyngeal exercises. How to stimulate cranial nerve 9. Imitate the action of sucking on a lollipop, as infants do with their thumbs. Engage in actions such as gargling or yawning while maintaining focus on the back of your tongue. Tongue push forward. Roof of mouth push-ups. Tongue push-ups. Tongue push to side. Tongue extension. The vagus nerve, cranial nerve 10, is the longest nerve in your body. The vagus nerve, cranial nerve 10, role and function. Role, controls heart rate, digestion, and breathing. Function, motor and sensory. Perk, increases flexor tone. Location, the medulla. Vagus nerve, cranial nerve 10 primary functions. It serves as a primary conduit between the brain and various organs, including the heart, lungs, and digestive system. It exerts significant influence over heart rate, breathing, and digestion. The vagus nerve plays a pivotal role in the parasympathetic nervous system, which is responsible for the rest and digest response. Vagus nerve, cranial nerve 10, functions in depth. Heart rate regulation. It facilitates the deceleration of heart rate. Breathing patterns. It influences respiratory patterns. Digestive stimulation. It initiates digestive processes. Taste perception. It contributes to the sense of taste at the base of your tongue. Sensory input. It receives sensory information from the throat, portions of the inner and outer ear, and the meninges, enclosing membrane. Motor control. The vagus nerve controls muscles involved in speech, swallowing, and vocalization. Visceral sensation. It provides visceral sensation to the heart and abdominal organs. Vagus nerve stimulation. How to stimulate cranial nerve 10. Self-ear massage. Alternate nostril breathing 4-7-8. Sternum tap. Engage in laughter, singing, and other forms of joyful expression while exercising. Have fun. Let's stimulate. The accessory nerve. The cranial nerve 11 innervates the sternocleidomastoid and trapezius. The accessory nerve, cranial nerve 11, role and function. Role, controls neck and shoulders. Function, motor. Perk, increases flexor tone. Location, the medulla. Accessory nerve, cranial nerve 11, muscle function. Neck flexion, contracts to bend the neck forward. Head rotation, when one side contracts, it rotates the head to the opposite side, contralateral. Lateral neck flexion, contracts to tilt the head to the same side, ipsilateral. Posture maintenance, helps stabilize the head and neck. Breathing, assists in forced inhalation by elevating the sternum and clavicle. Accessory nerve exercises. How to stimulate cranial nerve 11. Spinal accessory nerve flossing. Scapula protraction and retraction. Head tilt while performing scapula protraction and retraction, elevation and depression. Let's stimulate. The hypoglossal nerve, cranial nerve 12, controls the muscles of the tongue. The hypoglossal nerve, cranial nerve 12, role and function. Role, controls tongue movement. Function, motor. Perk, increases flexor tone. Location, the medulla. Hypoglossal nerve, cranial nerve 12 functions. These muscles are responsible for shaping the tongue, moving it for speech, swallowing, chewing, managing proper breathing during intense physical activity. Hypoglossal nerve exercises. How to stimulate cranial nerve 12. Tongue push-ups. Roof of mouth push-ups. Tongue protrusion. Tongue click. Tongue curls. Lateral tongue movement. Note: if you stick your tongue out and your tongue is pointing to the right, it means that the right side of your cranial nerve 12 is weaker on that side. This is the nerve network. Cranial nerve anatomical map connections. Bonus exercises for your parasympathetic powerhouse. Add these to your normal routines. Raise your eyebrows with wide eyes and enhance cranial nerve 7. Make a big smile. Enhance cranial nerve 7 again. Flatten tongue to the roof of your mouth. Enhance cranial nerve 12. Swallow and enhance cranial nerve 9. Turn your head left and right to enhance cranial nerve 11. Shine a light in your eyes at an angle to constrict pupils. Enhance cranial nerve 3. Add humming and enhance cranial nerve 10. This concludes our active training course with Allegri. Thank you for attending. Have a wonderful brain.